Hi, everybody. As promised, this is Dr. Lisa, and I'm here with my good friend, Dr. Reginald Robinson. Dr. Robinson is a heart doctor, also known as cardiologist. So, you want to say hello to everybody?
Hello, everyone.
Dr. Robinson, I appreciate you talking to me today. My concern about heart disease is that we, especially in the black community, are losing people unnecessarily because heart disease is preventable, right?
Mm-hmm.
So, can you give people just a general overview of what heart disease is and how they know they might have heart disease or at risk for heart disease?
So, heart disease, cardiovascular disease is a big umbrella term. And I'll start out with the things that most people understand as being a heart disease: heart attacks, someone with congestive heart failure or weak heart, someone who's had a stroke, that's a cardiovascular disease. Then you can add hypertension or high blood pressure, high cholesterol, aneurysms. People call it poor circulation, or we're going to get fancy and say peripheral arterial disease. And if you include diabetes, diabetes is not considered, quote, a cardiovascular disease, but it is a cardiovascular equivalent, meaning that if you have diabetes, you have a 20% 10-year risk of having some kind of vascular event.
Mm-hmm.
So it shouldn't be sitting out there on its own. Doctor tells you have diabetes and you just forget about it and not think about all the complications that diabetes can cause.
Mm-hmm. So, you mentioned aneurysm. What is an aneurysm?
So an aneurysm is just an enlargement of any blood vessel, whether it's in the brain, the belly, the chest, the legs. If it's larger than normal, it's called an aneurysm.
Mm-hmm. So, that's a lot of information. If all of these things are preventable, high blood pressure, heart attacks, we didn't talk about kidney disease, but that's also linked to
Right.
to heart disease, right?
Well,
Go ahead.
Yes,
You
it
wanna-
is. So,
how is it linked?
well, kidney disease, it travels in the same bus as a lot of the other things, right? So if we have a patient or a person that has hypertension, the likelihood of developing kidney failure if it's not treated is high, probably 3 to 4 times more likely to end up on dialysis if it's not controlled.
Mm-hmm.
Add diabetes to that, then you're now up fourfold of having a chance of ending up on dialysis. If you have diabetes, hypertension, add obesity, that all goes along with that. So you have now driving in that same truck, obesity, hypertension, diabetes, it's all related.
Yeah.
So I call it TLC, or total lifestyle change, is what can help modify. I can't say that 100% of things are treatable, but a large percentage can be modified and prevented.
So it sounds like people are dying unnecessarily if this is preventable. So if
Yes.
it sounds like you have a prescription. So tell us about the TLC and how do people prevent heart disease?
So again, I love using analogies. TLC, total lifestyle change, tender loving care, whatever you want to call it. I tend to say total lifestyle change because it is a total lifestyle change. One of the analogies I always like to ask people is what kind of gas they put in their car, right? So many of them will think about it and say, I put premium in my car, or I put regular, and I say, why don't you put diesel in there? Just put diesel in there. And then they're arguing with me. They don't get the point until I say, aha, your body's the Bentley, and you can't put diesel or junk in your body. So more people think about what happened to their car than what they actually think about what happens to their body. They will fight me down if I say, hey, you need to eliminate simple carbs, meaning some of the white foods in the diet, processed foods, white bread, white rice, white potatoes, white pasta, stuff made out of flour. Or if they're overweight and need some better control on their diabetes and blood pressure, tell them to say, pick you 4 days a week and just do plant-based. Most people can do that. I try to meet people where they are. You can't throw things down their throat and say, oh, you need to become a vegetarian, because that's not realistic in most people's lives. So most can actually modify that and do 3 or 4 days a week plant-based.
And what about exercise? You often hear people talking about the need not just to change the way you eat, but to exercise. And exercising can be a daunting task for a lot of people. So what is your advice about that?
Well, it depends on what they think about exercise or how they perceive it. You don't need to go to the gym to exercise. You don't need to lift weights crazy to say that you've done a lot. If it's safe enough, you can walk around your neighborhood. So then you start looking at those social determinants of health that impact health outside of our control. In certain neighborhoods, you might not feel comfortable with walking out and going, quote, to a park. Because certain areas you might not have a park.
So what should they do?
If they have stairs in their home, they can go up and down the stairs several times.
And if they don't?
If they have enough time, they can do some chair exercises. Stand up and down in their chair, lift their legs up, do some calisthenics in their home. There's so many, everyone has a TV that has cable nowadays, because otherwise you can't look at TV. There are exercise programs on cable. If you don't have anything else, most people have cable to be able to look at TV.
Yeah.
So they can find things. Most people have a smartphone. So you can find YouTube videos on basic exercises.
Okay, that's great suggestion. Those are great suggestions. I'm going to wrap this up and just ask you to respond to something I heard on the street. And I'm sure you know about Dr. Lisa on the street. We go out and talk to people about health issues. One day, a woman said to me she didn't want to get her blood pressure checked because she had just eaten a bag of potato chips. Now, I can understand why people are confused. There's so much information out there about what you're supposed to eat and what not to eat, but there's a lot of confusion. So to help with people's understanding of what they should eat, how would you respond to the woman who thinks she shouldn't get her blood pressure checked right after eating potato chips?
Well, I would say don't worry about that. It's a teachable moment. So every moment can be a teachable moment. If you see that you ate some potato chips and your blood pressure is extremely high, someone's captured you at that point. Whether you've eaten the potato chips, you've been for a walk, you sat down, someone's giving you a marker of what your blood pressure is at that moment. And it shouldn't impact it that quickly if you just ate some potato chips.
How long do you think it should? Because I think her concern was there's salt in these potato chips. I know there's some relationship between blood pressure and salt, so maybe I should wait. How do you help people
that's a hard one to say, but yeah. I would say check it anyway. Yeah. And there could be some guilt in that as well, that she knew she ate some potato chips, so she doesn't even want to know what her blood pressure is, because it's not about that potato chip that day. It's about her lifestyle that she's had all along, and not really wanting to know what her blood pressure is.
Yeah.
And we know that hypertension is the silent killer, so you won't feel anything while you're eating those potato chips or walking around or doing your day-to-day activity. So I would say if someone has an opportunity to check their blood pressure, they should check it. At least that'll get them motivated to check it in a different setting so that they can actually compare it.
Okay. Any final words, Dr. Robinson?
Well, I would say, just it's think of your body as your Bentley, right? And treat your body with more respect than you do your car. Because without your health, the car, your job, nothing else really matters.
And on that note, we are actually planning to do a video about the body car analogy, and maybe you should join us and be in that video. Okay. We can show you getting out of the Bentley.
All right. Can I have it after?
All right. Thanks a lot, Dr. Robinson. Always a pleasure.
All right.